Hello everyone. My question is a 65-year-old patient complained of sore throat, weakness, hyperthermia. Positive results of direct SARS CoV 2 viral testings were obtained. From the anamnesis, we know that the patient suffers from diabetes mellitus and hypertension and has high risk for progression to severe COVID-19. Define the drug for etiotropic therapy, explain mechanism of action, pharmacological effect, adverse effect and indications and contraindications for administration. As our patient is in risk factor with immunodeficiency condition like diabetes mellitus and hypertension, patient first require medical ventilation, non-invasive and invasive. Patient is admitted in dedicated COVID hospital and require oxygenation therapy. Caution trials of CPAP with oronasal non-invasive ventilation, high flow nasal cannula if work of breathing is low and intubation if work of breathing is high. Patient is also administered high dose of prophylactic unfractioned heparin or low molecular weight heparin such as enoxaparin because if not there is a high risk of bleeding. Etiotropic drug is administered is dexamethasone. Dexamethasone is a synthetic pharmaceutical anti-inflammatory medication. It chemically belongs to the class of organic compound known as 21 hydroxysteroid, which has molecular formula C22H29 FO5 and the molecular weight of 46 gram per mole. It is a long-acting glucocorticoid. Doses: recipe dexamethasone is 0.4% 1 ml. Dartell's doses number 10 in ampule. Cigna 1 to 3 ml intravenously, intramuscularly, intra-articularly 1 time per day. Recipe tablet is dexamethasone 0.0005 number 30. Does Cigna 1 to 2 tablet per orally 2 to 3 times a day during or after meal. Mechanism of actions. This figure models the interaction of a steroid with its receptor and the subsequent event in a target cell. The steroid is present in blood bound to corticosteroid binding globulin but enters the cell as free molecule. The intracellular receptor is bound to stabilizing protein including heat shock protein 19 and several other proteins. When the complex binds a molecule to the steroid, the HSP90 and associated molecules are released. The steroid receptor complex enters the nucleus as a dimer, binds to the glucocorticoid response element on the gene and regulates gene transcription. And the resulting mRNA is edited and exported to the cytoplasm for the production of protein that brings about the final hormone response. And so what dexamethasone do? Corticosteroid binding to the glucocorticoid receptor mediated change in the transcription of messenger mRNA. mRNA acts as a template for protein synthesis. Corticosteroids can either stimulate or inhibit the synthesis of specific protein. Thus, corticosteroids are known to stimulate the production of a glycoprotein called lipocortin. The form lipocortin inhibits the activity of phospholipase A2, which releases arachidonic acid. Corticosteroid inhibit mRNA responsible for interleukin-1 formation. These action of corticosteroids on arachidonic acid metabolism and interleukin-1 formation produce anti-inflammatory, immunosuppressive and anti-mitogenic effect. Pharmacological effect. Glucocorticoid mainly involved in metabolism. Carbohydrates are broken down into glucose leads to hyperglycemia, protein breakdown, loss of muscle mass, fats breakdown mainly from periphery such as in Cushing syndrome. Anti-inflammatory action mainly inhibits chemotaxis which is inhibit neutrophils at the site of inflammation used in inflammatory conditions so cause delayed wound healing. It is act as an immunosuppressant action, anti-cancer action and effect on blood. All the blood cells are produced in bone marrow. Glucocorticoid increase movement of neutrophils from bone marrow to blood, which results in neutrophilia. But glucocorticoid inhibit the movement of lymphocyte from bone marrow to blood, which cause lymphopenia. Indication: dexamethasone is used to treat conditions such as preterm pregnancy to accelerate surfactant production, arthritis, blood hormone disorder, allergic reaction, skin disease, eye problem, breathing problems, bowel disorder, cancer, immune system disorder. It is also used as a test for an adrenal gland disorder by dexamethasone suppression test. Adverse effect includes vision changes, swelling, rapid weight gain, sleep problem, mood changes, acne, dry skin, thinning skin, bruising or discoloration, slow wound healing, increased sweating, headache, dizziness, spinning sensation, nausea, stomach pain, bloating, muscle weakness, or changes in the shape or location of body fat. Contraindication used in preterm infants may be associated with an increased risk of cerebral palsy. Continuous treatment for over 10 days can produce adrenal suppression for 3 to 4 weeks. Contraindicated in systemic fungal infection and tuberculosis, malaria, high cholesterol, and diabetes in chronic use. In hospital setting, insulin is administered regularly as our patient is diabetic. For investigation therapy, drug named remdesivir 200 mg intravenously on day 1 and 100 mg daily for next 4 days is administered. Convalescent plasma 200 ml single dose may be repeated for more than 24 hours. Remdesivir is a broad spectrum antiviral drug act to inhibit the SARS-CoV-2 RNA dependent RNA polymerase, which is essential for virus application. Tocilizumab 400 to 100 mg can repeat after 12 to 24 hours. It is an immunosuppressive drug which target interleukin 6 receptor pathway. Thank you.